Medical doctors are urging COVID-19 survivors who have identified some changes in their bodily functions or any post-COVID symptoms to immediately seek medical support in order to remedy the situation. This follows recent research of the effects on some people who have survived COVID-19. Seizures, mental health issues, infertility, and erectile dysfunctions are some of the findings. Dr. Justice Yangsin, who was speaking on Joy FM Super Morning Show, stated that even though reports are not conclusive, damage caused to the testicular cells by COVID-19 through hyperinflammation of the cell tissues may affect male fertility in the long run. He said this while explaining the effect of the COVID-19 on sexual health of male patients.
Post your recovery, like you described, you're testing negative, you're being discharged from the hospital and what have you. There are residual problems or complications that these patients will have to grapple with, especially those who get moderate, severe critical illness. And then even those with mild conditions who have been treated at home and all that, they also can get these problems post their recovery. And the problems cut across all organs. You may not have all, but you could have a combination. It could be 2-3 different systems or organs involved. It could be just one for you. But the long and short of it is that post-COVID problems are there. Let me just mention a few of the things we see, and then we'll zoom in on why ED or erectile dysfunction in particular. You can have situations where these people will keep having the problems, and sometimes they've been described as the long haulers. For 100 days, for 6 months, they still have problems. So fatigue, things like muscle weakness, difficulty breathing, difficulty sleeping, hair loss, loss of smell, taste, problems with, say, their mobility, issues around, let's say, mental health, depression, anxiety, some neurocognitive, disorders. So somebody, for example, like the sort of things you may see in somebody with, say, dementia, those ones are described as neurocognitive. So maybe loss of memory, stuff like that. They are affected. Some are beginning to get seizures and what have you. It's all because of the problems that COVID has created. And a lot of it is as a result of what we call the hyperinflammation that occurs when COVID-19 is at play. And that results in all these residual issues.
So are there some people who are more susceptible to these post-COVID effects, like maybe older people or people with particular pre-existing conditions, or people in a certain part of the world? Who is most likely to end up with, erectile dysfunction or any of the other post-COVID symptoms?
Well, the truth is that the research is still ongoing, but the figures show that generally, like I said, those who get severe critical illnesses, those with moderate disease, tend to have these things the more. But of course, even those with a milder form, they also get. What we have also seen is that those who have some general, let's say, disease burden, poor health generally, may also come up with these things. But the long and short of it is that all these things we have described, the hyperinflammation and what have you, the blood clotting and all the bits, result in a situation where you have damage to the vessels. The middle organ is such that it is blood that is pumped into it for the erection to be sustained, or for you to see that, yes, it has grown inside. It's a spongy tissue. So as and when it has to erect, blood is pushed in. Now, some of these blood vessels that go in there to supply, and then those within the organ themselves, the organ itself, are destroyed by the COVID disease through the hyperinflammation activities that we are talking about. So the linings are destroyed, some are blocked, some clots may also form. So once you have this damage to the vessels, then you can have this problem.
Can it be fixed? Can such damage be fixed?
Hello?
Sorry, I was just wondering, can such damage be repaired?
Well, you may have to see a urologist for assessment. So probably, if you give me a bit of time, we'll get to that bit in no time. Then the heart itself, that also has to pump the blood. The heart and the heart muscles and all that are also, destroyed by COVID. So you have cardiomyopathies, myocarditis, all kinds of things happening. So the blood that has to be pumped there sometimes also is a problem. So this, for example, that kind of problems with the cardiovascular or vascular system can result in this erectile dysfunction. Issues around mental health. It affects your mental health. When the brain is attacked and all that, you may end up with some emotional distress and all of it, anxiety, depression, all the things you can talk about. Not just the attack on the brain, but even the circumstances around COVID, the isolation, the loss of family, friends, all the bits that happen can lead you into a situation where you could get, say, depression or any of the mental health or psychological illnesses, and then you end up with some emotional distress, some low libido, and ultimately that poor mental health will also result in some poor sexual function. And that will result in a situation like the erectile dysfunction. The overall disease burden, poor health, medications that you are taking put together could also result in it. Then there's sometimes also damage to the testicular cells, the cells within the testis. That is where testosterone is produced. And generally speaking, that is what makes us men. Testosterone is what makes us men. So when the cells within the testis that are supposed to produce this hormone are also destroyed through the hyperinflammation that COVID brings about, then you have a situation where your testosterone level.
That's Dr. Justice Yankson there. So you just have to be aware and just to steady your body and understand what is happening. You need to report as well. Well, some of you have already been flooding our console with so many messages. Let's see what you're saying. Okay, let me just put this right. Let's see. So this one says we are dying. Says we are dying in this virus seriously. Amusa Anani Christian Kofi is sending that from Japan. Well, we're not dying if we do take care of ourselves so that we are not infected. This one says the surge in the cases is a signal that we need to lock down. This is because our facilities are not capable of containing large numbers. You don't add your name, not to any of the messages that you've sent. Please. Okay, you were just sending a correction. This one says COVID-19 is real, but measures are difficult on the part of hospitals and government, and soon a serious lockdown awaits us. You don't also add your name. This one says, personally, I think the surge in the COVID-19 cases was bound to happen, considering the negligence of most Ghanaians and our leaders who continue to push their political agenda without taking into consideration the number of positive and critical cases. Firdaus Adam from Sotum. Firdaus, thank you for sending your message. But the health experts have said that enough of the blame game. We ought to keep going on observing the protocols. This one says, the students in the Upper West region have not received nose masks yet. Primary school pupils have not. What is the problem? Please, let's find out from the government through your media. Leferi from Magu sent that one. So Ghana Health Service, there is a message from the Upper West region saying that primary school students still do not have the PPEs that they are expecting. This is pretty long. I'll try and read a bit of it. It says, good afternoon. Isolating suspected cases of COVID-19 in the same building, and more specifically the same room or hall with shared washrooms, is one of the contributing factors to the high rocketing spike, too many words put together, of the infections, because at that moment the results may not come in for which others may spread the virus to their colleagues isolated, as many asymptomatic cases. So let me try and understand your message. Your message is that when we isolate people and we put them in the same room or in the same building, so for example, the Konfanochi Teaching Hospital, where they are in the same hospital but using the same washrooms, you are saying that if that happens, that is one of the key things keeping our numbers of infections very high. I'm not quite sure what the situation is because what we know is that the triaging process at the time we were told about it was that it was kept, people who come in with any symptoms are kept separately from those who are in the hospital for non-COVID cases. But certainly as we go along, we can get some more explanation on this. You are Bettinos Degra. You didn't tell us where you're sending it from, but you say that it's time we rethink and consider our isolation centers and protocols before it gets out of hand. Let me do the very final one or two. This one says, about the COVID insurance package, the government has not delivered. Imagine being a nurse taking care of COVID patients and ending up with the infection, going on admission for 12 days and finally being discharged with complications from COVID-19. Heart complications, myalgia, I hope I got it right, and still nothing from government. Okay. I'm sure that the packages are still being worked on. I don't have the answers. I'm just thinking aloud, but we'll follow up on that one.